With hospitalizations on the decline, Governor Cuomo says the state is launching the most aggressive antibody testing in the country. He says that it will help determine whose immune system has fought the coronavirus and how it can reopen the economy. CBS 2's Lisa Rozner live in Midtown with more on this development. Lisa?
Well, Christine, this med right here on West 42nd Street is one of several across our region that started these tests last week. It's already administered more than 100 at this location alone, but still, some say the state's rollout is nowhere near the demand, and there's many questions about the test's accuracy.
West Village resident Adam Weiss believes he was one of the first to get a vial of blood taken for an antibody test Friday. The blood test sees if you made antibodies, which is what humans use to fight off the infection. He walked into MedRite without an appointment and paid $175 out of pocket, even though they take insurance. He's been wondering if he had the virus after traveling to Miami and Washington State in February.
I just had this cold like I never had before.
The results came back today negative. MedRite and practices like New York Internal Medicine in Whitestone are utilizing the test produced by Brooklyn-based Lanco Labs. It is not FDA approved, and Lanco is part of around 100 companies offering antibody testing, since the agency is now allowing tests to be sold without formal review. Only a select few have the FDA's approval, including Mount Sinai Laboratory. It screened 6,000 people and identified 1,000 with high antibodies.
Even a very small false positive rate could lead to hundreds of thousands of people being told that they're safe when they might not be.
New York State is using its own fingerstick blood test, and starting today, samples of 3,000 people are being collected for a population of 19.5 million. The governor says patrons of supermarkets around the state are being recruited at random for testing. Pollsters find a sample size of 1,000 is a good marker with a very low margin of error. But Dr. Bruce Wiley of CUNY's Graduate School of Public Health says it's only a start.
Alone is not going to help relax social distancing measures or reopen the country or the state or the city. To do that, you actually have to know more specifically, who has been exposed.
Dr. Stephen Spitalnik has overseen development of a test distributed to some health staff at Columbia and New York Presbyterian hospitals.
We also do another nasopharyngeal swab to see if they're still positive. And between 14 and 28 days after resolution of symptoms, we and others have found that up to 30% of individuals are still positive by the nasopharyngeal swab. And what we don't know, and they have antibodies too.
And still, New York State has not said if you test positive, whether you can use that result to return to work sooner than later. Another big piece here is coordinating all these results between the state and the federal government. Live in Midtown, Lisa Rozner, CBS 2 News.